I think it asks you guys for permission if it's okay that I record. Okay, so this is chapter 10, and the chapter is going to talk about calculating parenteral medication dosages. I don't know if you remember, but parenteral medications, that's when we're talking about medications that are administered by injection. Either the injection is going to be either given intravenously, in an IV. It's going to be in a shot, right in the muscle, intramuscular, subcutaneous, or intradermal. So any of those are considered to be the routes for parenteral medications. And thus the administration of the medication, that remains the same. We have to follow the medication's name, make sure that it's got the right dose, that we have the right route, and the frequency as well. And the patient's 6 medication rights as well, we always have to follow those as well. The right name, the right medication, the right route, the right time, the right frequency, all of that should always be confirmed again. The example here that you see, we have the patient's medical record, and then the physician's order. You see here as an example, we have the medication's name. This is a hydromorphone. It's dilaudid. It's a really strong pain medication, like 10 times stronger than morphine. The dose is 1 milligram, to be given subcutaneous every 6 hours as the frequency. So all of those are, will be the components of your parenteral order. And then when the doctor makes this order, then it gets transcribed into pharmacy, and then we have to confirm with the label when we are going to give the medication. I'll show you, because with medications such as hydromorphone, or medications that are small dosages but are really they're very potent, we have to make sure that we are drawing the right amount. And in order to prevent medication errors, sometimes they give them to us pre-filled. So we already have a pre-filled syringe, so we kind of have to discard. We have to use, like, if I'm going to give half an ml, I have to give that half ml, but discard the other half ml because and the machine needs to be notified, and I'll tell you about that a little more. So here in this slide, you see the components of the parenteral medication label again. This is in the actual label. You're going to see the name, and this is what you're going to be looking and checking. After you get that order and it gets sent to the pharmacy, you're going to see the medication, and we have the name, the dosage strength. In this particular label, it says 2 milligrams per ml. And what was the order? Do you guys remember? Routes of administration. You see that in your label here, it says that this can be given subcutaneous, it can be given intramuscular, or it could also be given as a slow IV use, or IV, we give it an IV push. It's called small IV push. And then the container, it's going to be in a vial. So it's the type of container. And then we see here that it's a controlled substance number 2. So this is a high alert, right? This is like a type of medication that we know we have to be careful, because there is a high chance that the patients can become dependent on this medication. So we have to, be careful. Storage information here on the bottom says it needs to be stored under, I think I can read 68 to 77 Fahrenheit, and it also gives you Celsius. And then the other thing, the expiration date of the vial, if it hasn't been opened before. And then you guys remember that we have single vials, like in this particular medication, this will be a single dose. And like I said, the order here, it said 1 milligram. So I would be getting 1 milligram out of here, which is going to be like half an ml, and then discard the rest. When we discard the rest, and this you won't get to know more until you're in the program, in the nursing program. But whenever we're dealing with narcotics or controlled substance medications, we always have to have a second license, so a second nurse or somebody that's licensed to check that we drew the right medication, that we got that half ml, and then the other 0.5 ml got discarded. The second license is going to enter their initials and in the computer, as well as, you know, the second person that witnessed that the medication was discarded. And you guys, you'll be amazed, you know, you will be like so shocked and surprised to see of how many incidents have happened and why did they have to establish those rules to second license medications like this. Okay, so in parenteral medication containers, you're gonna see that medications are either in the I'll show the vial at last, but medications can be they can come in ampoules, as this one. And I know in Mexicali they still sell a lot of these ampoules, the vitamin B12, the Bellevectas, and they still come in a glass ampoule. We still use them too over in the United States. We still use them too. And sometimes these ampoules are kind of like plastic as well. So they have to be broken. Normally you clean with alcohol, and then you are going to break the vial away from your face, and then it will open up. And then we have the mixed O Vial. This is another type of container. And this one has this rubber here. And what you do is that you press, you see right here, this little box, or this little, the part of the top of the vial. The powder is here, and the powder is right here. The liquid is right here. When we push this down, we're pushing the rubber. We push the rubber down, and then the fluid will be mixed with the powder. So these ones, they normally mix right away. Steroids, we use this type of vials to mix steroids, and sometimes antibiotics that we just, you know, have to break. So it's just a really nice and convenient way to, because he already has the fluid in there. You just have to mix them up. It's very nice and convenient. Then we have the traditional vial that we use, which is this kind. We use a lot of antibiotics on this type of vials. Most medications actually come in this type of vials. And then we have the pre-filled syringes. I don't know if you guys have ever seen this type. And this type of medications normally come pre-filled because of the risk of an overdose, of a risk of giving more than. This is amiodarone. This is a very strong heart medication. So normally the dosages come really small, and they already give you a pre-filled syringe. When we deal with pre-filled syringes, they're never going to be bigger than 3 mLs. Okay, they're always going to be like small pre-filled syringes. And the reason is because we normally don't push more than 3. We normally don't give more than 3 mLs in an injection on a person. So there's no point of you know, pre-filling a syringe greater than that. So normally they're anywhere from 0.5 ml to 3 mLs on a pre-filled syringe. And just some examples of pre-filled syringes are the patients that are admitted in the hospital. We normally put them on anticoagulant medication so that they don't, from being laying down, we don't want them to develop a clot or any complication from being at the hospital. So we give them this heparin injections in their stomach, or, you know, subcutaneously. We give them heparin injections once or even twice a day. So we give a lot of sub-Qs. And normally those come in a pre-filled syringe. In some cases they come in a vial, but depending, they will come in a pre-filled syringe, which is pretty cool to administer, because you still have to be careful because they might order half of this. So you have to discard half, like if they order 75, you have to discard 1.5 from the pre-filled syringe. Okay, so talking about a
quick question. I'm sorry.
Go ahead.
If you go back to that pre-filled syringe, heparin is not a controlled substance. So if you discard this, are those same barriers still in place, where you have to only with controlled substances?
Only with control. Thank you for asking that, Jennifer. Normally, the reason why they do the pre-fills is because it's very common sometimes that we do it in the practice. So it's like it's already there, right? And when we're talking about discarding, the only medications that require a second license are going to be narcotics, those opioids, morphine, Diluent, all of those, fentanyl, all of those require a second license. And also insulin, but not for discarding, only for before you administer insulin, you always need a second license. So let me go back a little. You need, for discarding purposes, you only need a second license when you are administering or you have administered narcotics. That's the only time you need a second license. And same thing for tablets. If you have to discard half a tablet, you need a second license to go ahead and go discard. And we have a special container to discard those medications. So you know, and then somebody else signs off. If it's heparin or if it's another injection that you need, like this amiodarone, that you need to discard half of it, you do not require a second license. You just discard it and you just documented what you discarded and how much. Okay. And then talking about insulin, because it comes in units and there is a big margin of, you know, like the risk for errors, you always want to have a second license to check your insulin at first. You know, like, oh, is it 15 units? And then you check with somebody else. Yes, it is 15 units. And then you go ahead and get give your insulin, because insulin, you know, it could be easily mistaken that you give 15 units instead of 5, and that's a big difference. It can drop the patient's blood sugar like really, really easily. But yeah, thank you for asking, Jennifer. So the single dose and multi-dose vials, again, I think I talked about this a couple of presentations before. You're gonna see in the vial, if you have a vial, it's gonna say in there if it's a single dose vial or not. And the difference in between both of them is that single vial medications, they're just meant to be given once. They're just meant to be punctured. You know, the vial's only being punctured once, and then after that it needs to be discarded, and the medication as well. And the multi-dose vials, they do have preservatives and they can be stored you know, for a period of time. Whenever you have multi-dose vials, you have to see, you know, for how long are they good after they have been used. And it says, normally that says in the back of the label. And also you need to label these vials. If you're dealing with a multi-dose, you have to label it. And there's some vials that are good for 7 to 10 days after you open them. So you have to label, you know, put the date and the time, your initials, and you know, when you opened it. And very important, normally we have some pre done labels, and it tells you just have to fill in the lines, like who opened it, at what time, and when it needs to be discarded. So you have to do the math and put when, after what date it should be discarded. So that's the difference in between both of them. And then talking a little bit more about the pre-filled syringes, like I said, it depends, you know, like when they do this preset volumes, it's very convenient depending on the medication. I know doctors try to order medications that are, you know, like kind of like standardized dosages for patients. So if it's, you know, that way there is less medication that needs to be discarded, but sometimes it does need to be discarded. And for that reason, you know, like it also comes with its own calibration so that you can see, and it tells you, know, this is a 3 ml syringe. And they normally have the pre-filled syringes, they normally have a little bit more space, and you will see that there's a Lovenox. It has like this much, like maybe like 0.3 of a space that's air. And the reason for that is so that you can add, you know, if you have to add something else to it, or that is compatible, of course, that you can add in there and give it all in one shot. And then pre-filled syringes normally are for single dose medications also. So they're normally not meant for multi-dosing. And this is old stuff, guys, the pre-filled cartridges, but they're still out there, okay? The pre-filled cartridges, we use them, and they're normally in the crash cart. We have them at the nurse's station. The more and more, you know, we get more sophisticated with medications and vials, the less that we have to use these cartridge holders. This is the pre-filled syringe will come, and you see right here has like a connector. This attaches to the cartridge, and then you kind of like screw it, and then you administer the medication. So after the medication has been administered, you know, you only discard this portion, and this is a multi-use. So we use them a lot. We have them in the crash cart. I don't know if you know when we have a code on a patient, we have those cartridges there for some medications that need to be pushed that way. But like I said, we hardly ever use them, but they're still out there. Okay. So I think I already told you this, whenever we give medications or they come in a container, they're normally only meant to be given anywhere from 1 to 3 mLs, because if they're going to be injected, we cannot inject more than 3 mLs on a muscle. And you will do this in nursing, but in the deltoid, which is the arm, we don't want to give more than 1 ml of fluid. And we don't usually do antibiotics on the arm because the antibiotics are pretty thick. And if you give it in the arm, the muscle is not that big. So it's really, really painful. So you want to use large muscles. We have the vastus, which is the one in the thigh, the lateral side. We give up to 2 mLs there. And then the side, the vastus lateralis, which is on the side, that one can take 2 to 3 mLs on an injection. And then the dorsogluteal, which is the upper buttock here, and that one takes up to 3 mLs as well. And we don't do the dorsogluteal anymore, very, very little. You'll see that it's still being done, but there's like a large, the vagus nerve, and there's a large artery that goes through the back of it. So it's kind of dangerous. So right now they're minimizing the use of the dorsogluteal, which is the pumpy, the left upper outside of the buttock. So anyways, they normally medication, they're meant to be in 1 to 3 mLs because of that reason. If it's going to be a medication that can be given through the IV, you're going to see that the vial is going to be, it's going to be able to hold more, and it's going to have a larger volume. Okay. And then for parenteral medications, it's the same thing. We use syringes to administer the medication anywhere from 1 to 3 mLs. So labeling parenteral medication container. So like I said, when we have one of those vials that have that are multi-dose, we obviously, yes, we see the expiration date. We see the expiration date on the vial, but we have to be very careful that we see once the vial's been opened for how long is it good for. So it is our responsibility to label the vial with this particular characteristics, the date, the time, the initials of the nurse, and very important, when the vial needs to be discarded. Okay, so I have been in the hospital multiple times with students, and we open up the patient's cassettes and we have the insulin, and it doesn't have this label. Could I use it? Should I use it? No, right? I have to open up another one. I have to call the pharmacy and tell them, you know what, I have this insulin vial, but it doesn't have the information of, discard, and then they send me a new vial. So we have to be very careful with that, because it's a lot of unnecessary use of medications, but we have to be careful. Another thing I was going to say, you have to check on the vial to see for how long is that good for. Okay, for insulin, it's 28 days. So when we label my insulin, if I label it July 8th, I have to add 28 days to that, and we normally have a calendar, and then we just put it needs to be discarded after such and such date, not 20 days. I have to write down exactly when. Okay, so let's work on this problem. It says it's just knowledge to see if you guys can catch that information. The order says the prescriber order adenosine 4 milligrams IV for a patient. The nurse has the following vial of adenosine, and the question is, how many milliliters will the nurse administer? See if my pen is charged. So you see that we have 2 different dosage strengths in there. We can use, either one. We can use either one. We're going to get the same answer. Well, I think we have I'm going to go straight to are you guys working at it? Yes. I'm going to use the 6. So strength and measurement. Guys, what do you guys get? Did anybody use the dosage strength three over?
Yes, that's what how I did it. 3/1.
What was your answer?
1.33, and then could go on forever, I'm sure.
So either way, you're gonna come up with the same. Okay. And right here's the. Okay. So the concept is the same. The setup is the same as we learned with the oral. Like I had mentioned before, sometimes it starts getting a little bit more complicated because then we start adding the patient weighs 12 pounds, like, you know, like 12 pounds, and you have to give a medication that's like, I don't know, 2 milligrams per kilogram. Then you have to figure out a way. And before I end today, I'm gonna make one of those problems just so that to give you an example of how the whole conversion goes when we add the patient's weight, because that it's just adding one more conversion factor to the problem, but it does make it, you know, makes it obviously longer. So, okay, let's talk about calculating doses of heparin. So there are several medications that would come in units. Like I said, the anticoagulants are one of them, and heparin being one of the most popular ones out there. And like I said, usually the units of measurement with when we're talking about with units, they normally don't convert. They're gonna come the same. The doctor's order is gonna be the same as it is in the label. Okay, so what we have to work on is converting, you know, like how many mLs, what's the volume that I'm going to be giving to the patient. So you see the sample here. The unit of measurement is there, you know, like it's going to be in units, but it's, you know, says that for ml. So it doesn't really does not need that conversion of units. So which is great, but we still have to figure out, and because we are dealing with a lot of numbers, this is a very typical medication that we'll see, and we give a lot in the hospital. We give it like almost twice a day. You know, like a good portion of our patients will get heparin unless, you know, they're bleeding. But this is a strong anticoagulant, and we give it to prevent blood clots from forming so that they don't, you know, because they're just laying down or they're just sitting down. So we don't want them to develop a clot. And but are we good with that? You don't need to convert. Normally the order is going to be pretty straightforward. We have to figure out the ml. So we still have to do like if we have a 10,000 vial, I still have to put the 5,000 here, 10,000 and over, and then the 1 ml on top, so that we can figure out how many mLs do I need to give. So there's this other practice problem that maybe we can work on. I don't think it's in units, but let's do this problem. Oh my goodness, I erased it. Everybody got that? Yes.
Yes.
Okay, this other problem, it's patients to receive Duramorph, another, this is morphine, 0.25 milligrams IV now, and the nurse has a vial of Duramorph. How many mLs will the nurse administer? I think I have space to make this. And in this particular one, I like to use this one because my dose is pretty small, so I don't need to work with big numbers. So I think that's going to give me half an ml, right? You already got that?
Yes.
Yes. So remember, you're going to get the dosage strength that is more, that will work better for the order that you have. Let's do this one. This one's in units. And this is like the typical, this is a very common order that we get in the hospital. Although they try to put everybody on 5,000 units, but sometimes a lot of the times we have to work 3,500. Oh, I didn't cancel all. So I can get rid of 2, and I can get rid of 2 zeros. Did anybody get 0.35? Everybody got that?
Yes.
Is it more clear now, Jennifer?
Yes, what I forgot was that where you can cancel out the zeros. So it was just making it like a bigger problem.
Okay, yeah, just get rid of the zeros. That would help you a lot.
And I've noticed that if it's less than 1,000 and the dosage strength is like 1,000 per ml, those are easier. It's when it's like 35,000 over 10,000. That's when it's like, it gets confusing.
And we do have some antibiotics that come in, some penicillins. I forgot the name, the benzetacil or something. It's a penicillin that comes in a 1,200,000 units. And it's like, okay, like that's a pretty large number. So everybody else got the 0.35?
Yes.
Very good. So sometimes we have to, like it comes in handy and it's like super convenient to learn this metric line because it will save you so much trouble and converting and getting not everything will fall in the metric line, okay, but it will definitely help you when you're dealing with orders that are like 0.05 grams or things like that. So in order for you to convert them, and it will save you so much time in the exam. And believe me, like, you want to learn the metric line. So the same thing with the parenteral medications. The order is the same, and the way that the metric line system, the conversion on that, it works the same, and it will save you a lot of time. If the unit of measurement is not the same, of course, that's when we get to do this. Well, that's when we get to use that metric line system. Let me give you and some of the presentations I didn't remove. You'll see that in the presentations there is an example to solve problems, and they're pretty much color coded. Like, this is the linear ratio, but you guys don't need to learn that, or the fraction either. I want you to just, or the formula, which is yellow. I want you to stick to green, dimensional analysis, because that's what we use all through nursing. Okay, that's what we use all through nursing and even medical school as well. So we have an example here, and it says that the prescriber orders fentanyl 0.05 milligrams IV for the patient. The nurse has a vial of fentanyl that is labeled 100 micrograms or mcgs per 2 mLs. So how many milliliters would you administer, or would the nurse administer? So that's where the metric line comes in handy, because you're here. So if you're 0.05, right, and you're here, and we want to convert this into mcgs so that we can make our problem easier. So we would have to go 1, 2, 3. We will do 3 jumps to the right, which is going to be 1, 2, 3, and then my point will be there. So I have how many mcgs? So if I move my decimal point 1, 2, 3, I'm gonna have 50, right? 50, and that's gonna help me solve the order much better. So I pretty much converted. What I just did was I converted this into mcgs. So once I converted it, it's gonna be 50 mcgs, really, like 50 mcgs or micrograms. So if I convert it like this, so now it's more clear to me that I just need to find out the volume. And just by looking at it, I know I'm going to give 1 ml, because this is 100. So when I plotted utilizing the metric line, this is my order, and this is my dosage strength, right? So cancel mLs. So it's going to be 100 over 100 equal 1 ml, right? That's using the metric line system. Everybody clear on that?
Yes.
That's using the metric line system. You can also use the dimensional analysis, as you can see there. This is the order, and then this is what my dosage strength, the next component right here. And then you utilize the conversion factor so that we can convert the milligrams, so that we can cancel out the mgs and the mcgs. So I did it that way, which is going to, it's going to be a little bit longer, but yeah, you can also figure it out with dimensional analysis. It's fine. And my result is going to be the same, 1 ml. So either way, okay. Pretty cool, huh? Let's work this problem. And my order is so in here I have to, if I'm doing all dimensional analysis, I have to add my conversion factor so that I can cancel out this, guys. And then I'll multiply and then multiply. You guys get the same?
Yes.
And then if you use the metric line, you can convert that, how many jumps is it gonna be? 2 milligrams to mcgs, 1, 2, 3, it's gonna be the 200. So if we jump the 0.2, 3 jumps, you know, the decimal is gonna go 1, 2, 3. So it's gonna be 200. So it will lead us to the same, you know, I'm just converting it before, or it depends, you know, whatever you feel more comfortable with. Can I jump to the next one?
Yes.
Yes.
Okay. So this is a patient is to receive Robinil 150 micrograms IM now, and the nurse has the following vial of Robinil. How many milliliters would the nurse administer to the patient? This is another kind of like those small orders. And my dosage strength. Then remember, when you start with the order, remember that we make that imaginary one there. That way you know it's actually in the top. Cancel. You guys got the same?
Yes.
Yep.
I keep forgetting that you can take off zeros before dividing and just make
Yeah. I know. Yeah, I forget sometimes too. All right, that way, or or you can use the metric line to just help yourself know how many milligrams would 150 micrograms would be. Now, instead of going to the left, you're going to go 3 spaces to the right. So it will be 0.15, like if we move the 150, so this is a whole number, we're going to go 1, 2, 3. So it will actually be 0.15 milligrams. And then you can do your conversion, your dosage strength, and plot it into. All right, well, that's the chapter. That's chapter 10. You guys doing good?
Yes.
Let's go to the next one. And that will be chapter 11. Hi, Karina. And Stephanie.
Hi.
Two more people. Hi. Okay. So this chapter 11, it talks about preparing powder parenteral medications. So you're like, there's more to it. And I'm like, yes. So now we're going to learn how to prepare this medication. So we know that we talked a little bit about medications that need to be reconstituted. Or that's the word, you know, because they come in powder form. Same thing with the water, with the oral powder medications that we have to add diluent or liquid. You know, we have to add water to it. Same thing with the powder parenteral medications. So they need to be mixed. They need to be mixed, and they're not mixed prior because of the duration, especially those antibiotics. Most of the time is the antibiotics that whenever we mix them, they're only good for so long, for this much time. So that's why they still come in powder. Sometimes we have this really nice fancy vials that we just push them, or even the bags. There's some bags that we just kind of like break the seal and it automatically has the fluid and it just mixes up. So cool. But most of the antibiotics we would actually have to be adding the diluent. Okay, so that diluent is the liquid. What is it that we have to add? It could be different, and sometimes it's water, sometimes it's I mean, for parenteral it's going to be sterile water, or it could be normal saline, you know, normal saline, so that it's an isotonic solution, so that when we inject it, it doesn't do any change in the fluids, on the balance of the fluids and electrolytes. It lets it stay pretty neutral. So those powder forms, they need to be reconstituted, okay, or mixed. So that's what I mean when I say reconstitution. It needs to be mixed, okay, before the administration, okay. And we have to be very particular. This particular label here says that sterile solution may be kept in refrigerator for 1 week without losing its potency, so the strength of it, without losing anything. This one right here, it says use solution within 1 hour after reconstitution, okay, because then it'll start losing its strength, so it's no good no more. And then sometimes I've seen them that they get really thick. If you don't give them right away within a few minutes, it gets so thick, like it kind of like like it gets like kind of like clotted, not clotted, but like thick, like espeso, I was gonna say the word. It gets really thick, and it's very difficult for it to go through the needle. It is painful. So you don't want to wait. You want to be aware of how long is it good for. So when we have to prepare these medications, we have to read the instructions to see how much diluent do we need, what type of diluent do we need, and also you want to know what's going to be the dosage strength after you do it, okay? So you want to read that and have that in your mind already, know what you're going to do. Then you will withdraw the diluent, and then you add it into the powder medication. You have to shake it. In some vials, it says that you don't have to like vigorously shake it. You have to like kind of like just, you know, do it with your hands like this. You'll see all kinds of things and tricks that we have to make them dissolve faster, you know, like just, you know, just by moving it. And then once it has been mixed, there's some antibiotics that take forever for them to really dilute. And then once it's done, then we withdraw the right amount. Okay. So you carefully see and read the label and see the package insert for those instructions there. And then let's see a sample here. We have a cefazolin. This is a very common antibiotic that we use. And it says here, for IM administration, you add 2 mLs of sterile water for injection. And then it says to shake well. So the diluent is the amount is 2. The type will be the sterile water. The shake well to dissolve. Withdraw the entire contents, and then it says that once it's been diluted, it's going to give you a 2.2 mLs. once it's been diluted, which is going to be equivalent to 225 milligrams per ml. So that's what it's going to come up to. Okay. And that's one sample. And normally we call the displacement, that's a when you saw that, once you have added that the diluent, and then it comes up to this, it gives you a dosage strength. Whatever is left, it will be like whatever it's making the amount, be increased, or that's kind of like increased volume, but that's pretty much unknown. That is not something that we can know, because once it's been mixed up, that's why the label says it's going to be approximately, like it says, for this one says here, add 2 milliliters of sterile water, shake well, and then withdraw the contents. It provides an estimate volume of 2.2 millimeters, okay? And then it will give you the strength, 225 milligrams per ml. So the rest, or the remaining, that's called displacement, because we don't really know, exactly. So it's not 100% accurate, but it gives you approximately this much, okay? So most of the time, there's always going to be a little bit of displacement in there. So we got the powder, the diluent, and then the displacement, okay? So we have this other example of a dosage strength. On many other medications, you're going to see that it says the strength. For example, this vial says 500 milligrams per vial. That's what it is, 200 milligrams per vial. And then once you reconstitute, this medication is going to tell you, once it's reconstituted, it's going to say 225 milligrams per ml. Okay, so the vial has this, but once you reconstitute, you're going to really look into these numbers right here. Okay, you're going to really look into these numbers, because then it's going to be every ml is going to be 225. So really, in reality, is what, 450, right? 450. And then the remaining, will be kind of like displacement, like that extra. Or you have to, when we do the math, it'll tell you, if you want to give 500, you have to see how much you're going to draw, which is going to be, like probably 2.2, yeah, to get the 500. Okay. So, and again, if you put it on your setup, it's going to come out, it's going to come out right, as long as you plotted it correctly. Okay. So multiple dosage strengths vials. So this is where, it gets more fun. A lot of manufacturers, they will have the label, and they'll give you multiple strengths. They'll give you multiple ones. Like I had said, we're going to be careful on which one we're going to choose. We want to choose the one that's going to be closer to the order that we are given. If the doctor orders a specific, if the doctor orders 500, then I want to stick to this, then I want to stick to this. You will see that I think I have shown you like a few medications that have more than one dosage strength, and you're going to choose the one that's better. I've told you before, there are some medications, when we're talking about IVs, like IVs is going to be a larger volume. It's going to be more stuff that we're going to be infusing on the patient. It's not just going to be injected. So when we're doing that, we're going to be dealing with more standard dosages. A patient could be ordered 500 or 1 gram or 2 grams. So the medication insert, the packet insert, is going to have more than one dosage strength, so that we can, see which one of them we're going to be using. So this label is actually providing you with 5 different dosage strengths. And this is cefepime. That's another antibiotic that we use. And it tells you, if you want to have, if you have an order, 500 milligrams, this is what you're going to add, approximate available volume in milliliters. And then this is going to be the concentration. So, and it gives you one for each, one for each. It's the same as what I had shown you before, only that this is multiple dosage strengths, because when we do it through IV, it's more, we're dealing with more different dosages that could be ordered on the patient. Okay. The stability and storage of the medication. So that's the same. If you have medications that are mixed, they have to be either stored in room temperature or refrigerated. And it tells you the for how long and the temperatures that they should be. And that should always be there, okay? You just have to like make sure that you take a look at it so that you see. And you'll see that there are different temperatures. For example, here, before you prepare it, before you reconstitute it, you need to keep it on these temperatures. And after you reconstitute it, it's only good for 24 hours under this stable for 24 hours at room temperature, or 10 days if refrigerated. So if you keep it on those temperatures, okay? So when you're labeling vials that are reconstituted for safe practice, and for any prevention of other errors, or giving a patient something that's no longer good, you have to label the medication again with the date and time that it was reconstituted, what is it that you added, what was that the diluent that you added, the dosage strength that you made, you know, depending on the diluent that you did, when is it supposed to be discarded, and the initials. And again, this is stuff that we have already some preset labels, okay, for this. Okay, this is a single strength reconstitution. Another example, so you see it tells you the amount, like in this label, it says to reconstitute, add 5 mL of normal saline injection without preservatives. So that's one, because we also have single dose or multi-dose of normal saline. So it says to add the single dose of normal saline to make a solution containing 35 milligrams per ml, and then you shake to dissolve. That's pretty much, you know, what the label will tell you. Okay, so let's do this problem. Let's answer those questions. It says the physician orders cefazolin 0.66 grams intramuscular. The instructions on the drug label state for IM use, add 2.5 milliliters of sterile water for injection, shake well, withdraw entire contents, provides an approximate volume of 3 ml, which is 330 milligrams per ml. And then for IV use, you know, it wants you to see the insert for more instructions. So what type of diluent do we have? What's my diluent?
Sterile water.
Yep, the sterile water. And then how much?
2.5 milliliters.
2.5 milliliters. And what's the dosage strength that is going to become once it's reconstituted?
330 milligrams per ml.
And then how much would I administer?
.66 grams or gram.
So we would have to do a math problem, right? So how much is this, you guys? How much is this in milligrams? If we move
660.
660. It will be 660, and each ml has 330. So it would be, I mean, I'm just doing it with my head, okay? But if we were to plot it here, it's a gram. If we were to plot it here, we would have to do like the whole. And which is going to be it's going to be 2. Oh, let's take some more. It's going to be 2 ml. Sorry, my mental multiplication didn't go well. 660. So anyways, it's going to be 2 ml because it's gonna be 260. But do you guys follow me there? On the, I like to convert my, if I convert my grams, 1 gram is 1,000 milligrams. 1 gram is 1,000 milligrams. And if I 1, 2, 3, if I move my decimal the 3 places to the right, it's going to be 660 milligrams. So, which is 2 mLs. Do you want me to work the problem, or you guys are good with that?
I'm good.
Okay. So basically when you multiply this by this, you're gonna get 2 mLs, okay? Then we have, let me see, let's do this one. That's a physician's order, 700 milligrams of Ticardicillin, IM, and then you guys see the instructions there. I'll give you a minute so you can read the instructions. Okay, what's the type of diluent that we'll be adding?
Sterile water.
Mm-hmm. And then how much?
4 milliliters.
2 milliliters.
Yeah, because it's gonna be IM, okay? 2 milliliters, And then what's gonna be my dosage strength?
2.6 milliliters by 1 gram. 1 gram.
Okay. So now we have to work the problem out so that we can see how much would we administer with this if this is the order. If somebody else is faster than me, help me out. So we got 182 over 100. So it's I got 1.8. Do you guys get 1.8?
I got 1.82.
82. Yeah, because I still have the 2 to come down.
But you're gonna round it to 1.8.
We're gonna round it exactly. We're gonna round it to 1.8. Let me make my numbers a little bit more clear here. So sometimes I write down 180, so I got 82 left. So then I got 0. So it's 8, so it's 800. I got 20, and then
So when you round, so the 1.82 and you would administer just 1.8.
Mhm.
So that 0.02 that you would leave out doesn't affect. Is that why you're able to kind of round? Because it doesn't affect, I guess, the medication to use it or not use it because it's such a small amount?
Uh-huh. In that case, when we have a TV syringe, when we have a TV syringe, there is a way to get 0.02. There is a way. But if we have adults, if you're dealing with adults, you can round to the, remember that rule that I told you, the rule that we have, like if it's greater than if it's greater or more than 0.5, you go to the next next number, or if it's less than, then you go to the lowest number. You round to the lowest whole number. So we kind of like follow that rule. If we are dealing with a medication that's really, the dosages are really small, like if it's a pediatric patient, I will want you to go to the second decimal. So that very much depends if it's an adult or a child. Okay. So, and that is something that you guys will get that reasoning, when you're dealing with the specific patient, then you'll be like, no, it's just 1.8, it's fine. And then it's okay. But if it's a pediatric patient, you do want to go to the second decimal. Okay. So basically that's the way it goes. If I have a cancer patient that is very sick, and we normally do the dosages based on a body surface, or we do like kind of like the pediatric way, the by weight, we do go to the second decimal. But in a normal adult, in a normal average adult patient, we will stick with the 1.8. So
Got it.
And for testing purposes, I'm doing the same thing. If we're dealing with an adult, I'll leave it at 1.8. If it's a peds, you go to the second decimal. And back in my days, we used to go to the third decimal. So it was, it was very, very, the numbers, we have to like keep on going till the third decimal. But it's, I'll let you know, like if I have a peds patient, then you will know. Let's talk a little more on the multiple strength reconstitution. So like I said, sometimes we have medications that we have to use multiple, that we are given multiple dosage strengths, so that we can work out our dosage, our order for our patients. So you will do it based on whatever will be corresponding to the dosage that you have. Okay. And each one, sometimes those doses, sometimes you have to add a different amount of the diluent so that you can get that dosage strength. And that's basically the reason why those are there. Okay. So you have a sample here of a IV medication that has multiple strength reconstitutions. So you see that, and normally you'll see all this big old, because it's a lot of wording, you'll see all of this in the packet insert. And if you're at the hospital's even going to tell you exactly which one to use. But you'll see, like, for example, if you want to come up with 250 units, this is going to be your diluent. You have to add this much. And if you want to come up with 500,000, you have to add this much. And the million, that much. So this is that specific penicillin that I told you, the penicillin G potassium. They come in millions of units. And then it already tells you, like how much to add for how much for your dosage strength. So that's basically what that big old information, that chart will be. That doesn't mean you're gonna pick the one that better fits your dosage. So there's some other different formats or different ways of that you will see it written. So and it like this one says, if you add 23 mLs of diluent, it's gonna come up to this per milliliter. So this per milliliter. So that's basically what those are. And this is another type, another depending on the medication, of course. Okay. There's some other formats here that will tell you, again, 10 mLs per 2 milliliters. And right here, it tells you, like in this previous one, it only says the final concentration here. And then it tells you in this format, it says 200,000 units per ml. So it's giving you the dosage strength just in a different way, different format. Here, it's telling you the dosage strength, 2 milliliters for, you know, for the 1 gram dose. So 3 milliliters for the, in a 1 gram dose. So, and so forth. Okay. So they're just different formats for you to know. This one's a little bit more, I guess, you have to read the whole thing for it to make more sense, because it's all put in like in a paragraph type of thing. So okay, let's see. Let's see here. I'm not sure if we have to work each one of them. Yeah, well, the order says to give penicillin G potassium 1.2 million units IV. So 1.2 million units IV. And it says here, this is just the usual dose. It's giving you a, sometimes they go by the usual dose or whatever the doctor says. And then it's giving you the different types of diluents. So which one would you guys use?
Well, in this case, you could do either the 33 millimeters or the 11.5, but I don't know what would be a better option if you would do the one that's approximately closer to the 1 million units per milliliter.
Yeah, right. So can you do, so just by looking, and you can give that dose, you can give this dose in either one. You can give it in either one.
Okay.
So I know it's gonna take a little while. All right, let me see. If, who do we have? Jennifer?
Yes.
Can you work the first one? Can you
Yes.
work this one? Sarah?
The 75 milliliters?
Work it with the 75. Sarah, can you work the 33?
Okay.
And then, who else do I have? Volunteers. Montejano, they left. Okay, I'll do the third one. So. You tell me when you guys are done.
I'm done.
I'm done.
Okay. So what do we get for 75?
4.8.
Very good. Yep. And 33?
I got 2.4.
Very good. And I got 1.2. So I had the answers all along. Good job. Very good. So basically you just, you kind of like figure out how much would you have to administer with each one of those. And just by looking, you will see like one of you guys said, just you want to get the one that's closer to the dosage. That way it'll take you faster. Do you guys want to do another one?
Yes, please.
Okay. So let me see. Jennifer, you can do the first one. Hannah, was that you? Yeah, huh? You can do this. Hannah, you're here? Or no? Sarah, I think I saw Sarah.
Yes, I'm here.
Sarah, can you do the second one?
Okay.
Okay, I'll do the third one. Is there anybody else that wants to do another? No, but it's okay. As long as, we'll get the last one. So let's work them out.
Which is the other one that needed to get done?
Oh, the last one, the one that says 3 mLs.
Oh, so that's- I'm done.
Very good. What do you get? What do you
Well,
get?
I don't know if I did it right because it seemed too easy.
It did, well,
The first one, so I got 2.
Mm-hmm.
And then for the second one, for 18 millimeters, I got 1.6.
Very good. Yeah, you're both right. I got 0.8. And then did you do the other one?
I did the last one, I got 0.4.
You got it right. Yep. So that's basically it. So units are scary. They can be scary, but the good thing is that the unit of measurement, it will not, we have to, see how much volume we're going to give. So we just have to be very careful with all those.
But now that I remember to kind of cancel out all the zeros, it doesn't seem as daunting because it makes the number smaller, easier to work with, I guess.
That's good. Okay, that's good. Very good. So that's your chapter 11. So, and then I have chapter 12, which is the insulins. Do you guys want to take like a 3-minute break just to get up and stretch, or do I just go straight in? It takes me about
Either way is fine for me.
Chapter 12. Karina and Stephanie, you guys are doing all right?
Yeah, actually, I was gonna ask if I could see your work for the last problem, the one about the units.
Oh, sure. I think I wrote,
I just want to see how it's set up, really.
so I believe the order, I'm gonna just write it here. And the last one, I think the order, wasn't it 1 million? I don't know.
Yes, for the very last one, it was 400,000 over 1 times 1 ml over 1,000,000.
But the order, I think the order
Oh,
was,
oh.
yeah, the order. Well, let's say you have this order. That's the doctor's order, right? And then your dosage strength. And I think I picked, I think I have the 500. My dosage strength was 500 and 1 ml. So maybe I can bring the slide back because I don't recall how it was written. So the way you're gonna work it out is you put your order first, units, and then what I want to know is how many mLs I'm going to administer. And then my dosage strength was in 1 ml. So here you cancel out the units, and then you have to administer mLs. So I like to cancel out my zeros. So I have a lot of zeros that I can cancel. I can cancel 5 and then 5. So whenever you cancel zeros, it has to be the same amount in the bottom. So otherwise you can't. So basically I multiply 4 times 1 and then the 5 in the bottom. Oops. And that when I divide the 4 and 5, it's going to be 0.8 mLs. So that's how much I was going to administer. So each one of us, we all got a different diluent. So like it said, if you add this much, it's going to come out to this concentration. So so we all had different volumes to give depending on the dosage concentration. If you want me to, I can go back to it, Karina, so that you can see. But it's basically like depending on the dosage concentration that you're given, that you're going to add the diluent, but you want to choose the one that's closer to your order. So
I understand now. I just wanted to see it set up.
oh, okay, cool.
Thank you.
You're welcome. So this is insulin. So insulin takes a whole new chapter. I mean, a whole chapter, because insulin, like I said, it's pretty important, and there is a very big risk of getting the wrong dosages or pulling the wrong dosages, and this could be very lethal to the patient. So just in an overview, we have different types of insulins. Insulin is actually a hormone that is produced. It's normally produced by our body, but because of different conditions, sometimes it's genetic, sometimes it's because of medications that are causing our bodies not to produce as much insulin, or sometimes it could be the opposite as well. So whenever our body is not able to produce insulin, and insulin, just so you guys, we review a little bit more. Insulin, it's capable to break down sugar in our body. So that's how whenever if I eat sugar, my body's gonna recognize that, and it's gonna produce more insulin so that it can break down that sugar. If the person is not able to produce its own insulin, or not enough insulin, then they need this synthetic type of insulin, or they need as what we commonly know it as insulin, so that we can help them control their blood sugars. Okay, so like I said, there's many, there's several reasons why somebody could need insulin. There's like diabetes type 1, the juvenile diabetes This little ones or individuals, they are not able to produce, their pancreas does not produce insulin at all. So their blood sugar is really high. Sometimes we have patients that because of metabolic conditions, they're not able to produce the insulin, or they're not even able to break down the insulin in their body. So they need this insulin to help it. Sometimes what else? It could be, there could be many reasons, you guys, but that we might need insulin. So we have two different types of insulins, okay? We have the one that's called the synthetic human insulin, which is actually made out of DNA technology. And that's the one type. And as you can see to the right side, you see the regular, the two types of synthetic human insulins are regular human insulin or NPH, okay? Or the NPH, which is insulin isophane. And these are the common brand names for them. You will see that regular, it would have the R next to it. So you know it's a Humulin R, Novolin R. Those are the brand names. And then the NPH, Humulin N or Novolin N. Okay, and then we have some other type of insulins that they're kind of like analog. This type of insulins, they're more genetic, you know, they're genetically modified from actual synthetic human insulin. Okay, so you will see the different types of names for this type of analog insulins. We have insulin Lispro, Aspar, Glucilin, Gargling, and Detanir. So these are all the different brand names. So you guys need to kind of like memorize this too. You need to memorize the two different types and their corresponding insulins for that. Okay. So this one slide, it's got a lot, you know, like for you guys to memorize. But again, one is DNA technology. It's synthetic. This is synthetic. And the other one is actually made out of, you know, genetically modified synthetic human insulin. So pretty interesting, huh? So the insulin, each one of those insulins that I just told you, they're actually subdivided in different types. The type of insulin is one division, but also they're divided on their character. They could last differently, or they can be divided by the type of onset that they have, or the type of peak and duration. And just so that you know here, also you need to remember this, on the different types of insulins, each insulin has a different onset. Each insulin has a different peak and duration time, okay? So onset, what that means is how long does it take for that insulin to start, you know, to begin lowering the blood sugar. The peak time, normally the peak time is the time when that insulin, it's at its highest effect, when it's like, you know, when it's making the best of it. And normally that's when it lowers the blood sugar at the, you know, faster when it's at that peak time. And then the duration, it normally means for how long does the insulin can stay in the body, you know, like for how long is it going to continue staying and lowering that blood sugar. Maybe not as much as the peak time, but you know, it's still going to be in their system for a while. Okay, so those are the different definitions, and each one, like I said, each insulin has an onset, peak, and duration. Okay, so we also categorize them like this, like you will see that there is insulins that are rapid acting, and the rapid actings are those insulins that they'll start working 5 to 10 minutes after you give it. They're going to be at their highest, you know, at their strongest, working in their body of 1 hour after they were given, and they'll remain in the body for 2 to 4 hours. Then we have the short acting. It's a little bit more. They start acting at 30 minutes. Their peak time is 2 to 3 hours, and they can stay in the body for up to 3 to 6 hours. We have the other insulins, intermediate acting. That's a little bit more, you know, they take a little bit longer to start working, 2 to 4 hours, 4 to 12, their peak, and 12 to 18, that remains, you know, working in their system. And then we have the long acting. The long acting, if you give it If you give it at 8 o'clock, they're not going to start working until 8, 9, 10, 11, 12, 13, 14. They won't start working until 2 o'clock in the afternoon, somewhere around there. And between 2 o'clock and 6 o'clock, they'll start working. Their peak time, some of them don't really have a peak time. They kind of like they keep on working all throughout 24 hours, you know, like all throughout. So it depends. In the hospital, on our patients, we give the short acting a lot. Normally we give it like 30 minutes. We check the blood sugar like 30 minutes or 45 minutes before lunch. And then our goal is to give them their insulin 30 minutes before lunch arrives. That way, when they start eating, they'll start, you know, eating, and they'll follow this kind of like this duration. So we want to give them the insulin like 30 minutes before lunch, because if they don't eat within 30 minutes, what's going to happen that their blood sugar is going to start dropping, because the purpose of us giving it is to break down the sugar they will be ingesting. Sometimes we have patients that they forget to eat or they don't eat and they give themselves their insulin, and then we have really bad hypoglycemic episodes because of that. So this chart you guys see here, you guys need to memorize this chart. It's very important. Okay. Now let's talk about units. Insulin, they come in units and they're available and they're measured in units, and that's how they should be administered. There is only, you don't have to deal with any of the other syringes for insulin. There is an actual insulin syringe that we use, and it's orange. It's normally the tip of it is orange, and some parts of the syringe are orange. And then the label of the packaging of the insulin, the syringe, is going to say insulin syringe. You should not be using any other syringe at all. Every single time that you give insulin, it has to be with an insulin syringe, not other. Okay. So, and then it's like if the doctor says to give 5 units sub-Q before breakfast, this is 5 units of Novolog, you're going to see Novolog. And then normally the vial, they come in a vial, and the vial has 10 mLs. So imagine 10 mLs. And the vial has, the dosage strength is 100 units per ml, 100 units per ml. So that's a lot, right? So there's about, what, 10,000 units in that vial. 10, yeah, I think, yeah, one more zero. 1,000 units in that vial. So anyway, so if it's 5 units that you have to give, you're gonna just draw 5 units on the syringe. Okay. So it's very important that we know how to do the concentration of the insulin, I'm sorry, per, because it is per milliliter. Like I said, the vial that I showed you is at 100 units per ml. So always make sure that you look at that. Always look at that. It's also going to be written like this, U100, which is this is the concentration. So it's always going to be U100. Not always, most of the time going to be U100. Sometimes we have U500. So that's 500 units in 1 ml. So that's a lot of units in 1 ml. When do we use those? You will not see those vials in the regular floor. Normally we use those in the emergency room or in the ICU when patients come with really, really, really high blood sugars, and we have to use, we don't give it sub-Q, we give it in the IV infusion. We have to actually dilute it and give it in an IV infusion very slowly, but it's a lot of units that we're given. It's a lot of units that we're given, but it's given slowly. So here are the labels, you guys, so you can see this is the typical 100 units per ml. And then it'll say here as well. And this is like a highly concentrated type of insulin. So U500, and it says 500 units per ml. And it's even red letters, okay? And like I said, there's all kinds of warnings there. This is not a typical insulin that it will be given to a patient at home, never. It's only ICU and in the emergency room that you will see this type. And that's because they have their blood sugar like through the roof, like 800s, really, really high numbers. So then you see the components of the label here. You see that this one is the R. You see Humulin R, which is regular. It's also the brand name. And then you will see that in the bottom, it says generic, the generic regular insulin human injection. And then right here, it says you see the rDNA origin. This is the recombinant DNA type of insulin, right? The synthetic type. And then it says the concentration here, and then the concentration here as well, U100. Okay, any questions on that, you guys?
No.
Okay, so I'll move on. So we have two different types of insulins. I mean, from all the types that we said, sometimes we have to combine two different types to give it in one shot, okay? Most of the time, you will only give regular insulin to the patient, or you will give only one, one of those, either the short acting, fast acting, the intermediate, or the long term. Normally, we don't mix them, but if the doctor orders them to be mixed, sometimes we can mix them up. You will see that the doctor will order, for example, an intermediate acting. The intermediate acting are those that they will start acting 6 to 10 hours. That's when they start acting. And they might add an intermediate acting with a short acting at the same time. Those two you can combine. You will be able to combine those two. And the reason is that the doctor wants to like right here, he put Humulin regular at 730 daily. And then it says MPH, which is the intermediate acting, 16 units. And then the 5 units of Humulin R. So what the doctor is doing is giving some insulin, 5 units, for when the patient starts eating for breakfast. But at the same time, he wants to give 16 units that will probably start working by lunchtime. Like they want to mix. When does the doctor does this? On patients that are at home, like the patients at home, and they want to start, they want to get them covered for breakfast and lunch kind of thing. Okay. So they give the intermediate. This one's not going to be acting. It's not going to start working until later. Okay. So we can combine these two types of insulins in the same syringe. And then I'll tell you more about it right now, because the regular insulin it's normally clear in the vial. It's really clear. And the MPH, it's not clear. It's kind of cloudy. The liquid is kind of cloudy. So we can combine them, but we cannot mix them up in the vial. So that's another story. I'll tell you right now. So combining the two insulins, you see the two different labels, like the different labels. This one is Humulin R regular, and it says here regular as well. How many units? This is a rDNA origin. And then we have the NPH here, which is the intermediate acting. So you see the two different labels. And then they have the big N there so that you can see regular NPH. Okay. So those are the two that you can combine. And then for better and more convenience, there's some laboratories that they actually have the insulin already mixed up. They already have it mixed, pre-mixed. So these are different labels that you can see of pre-mixed insulins that they already combined. And they used to do this a lot. We are not doing it so much, but back in the days, they used to do a lot of this. In this particular case, Humalog, it says 50-50. It's because it contains 50% of the insulin Lispro, and it has 50% of the, it has 50-50 protamine, no, the insulin Lispro, and 50% of the DNA origin. So that's a mix. And then we have Humulin mix. We have a 75% of insulin Lispro and 25%. So it's 75 and 25, okay? And then we have the 70-30. This one's one of the most common ones, that it has 70% of the rapid, 70% of the intermediate. So and then here 70-30, another 70-30 here. So these are different pre-mixed insulin labels that you can see. Like I said, we don't use this much anymore. They use the pens. They use the pens because that decreases the chances of overdosing on the patients. And they will have us mix them up. Like if we mix them up ourselves. But I don't know, like 10 or 15 years ago, these were pretty common, that the doctor will order those premixed insulins. So, and then it will tell you in the label, like I showed you, what type of insulin, what's the percentage of each one of those insulins. And then the nurse will just, you know, draw the amount that the doctor requested. Okay. So here we have an example of a premix. This is a premix. The doctor orders, Novolog makes 70/30. He orders 18 units in the morning. So that's the order right there. Okay. So they order, the nurse will just draw the 18 units on the syringe, and that's about it. And administer sub-Q. You also, on the syringe, like I have told you, this is how the wrapping comes, orange. You see the orange color? So that, and then it's gonna say insulin syringe. You cannot miss it. It says insulin syringe. And then you will see as well that in the 1 ml is gonna say U100. So this syringe is for this type of concentration, U100s, okay? So, and this one is a 1/2 ml because sometimes they don't take, you know, they don't do the whole 100 units. So there's patients that only need like 5 or 10 units every single day. So they might need a smaller syringe, but still, this is the same, U100, 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 U100. And this one's even smaller. This is a 0.3 ml, that chiquita, like really, really small. So we have patients that they medicate, they give themselves their insulin. So they don't need the whole 100 ml unit because they need small units. They need 5 or 10 or, you know, small units. This is a 50 unit syringe. This is a 30 unit syringe. Okay, so and each little line means a unit. Super tiny numbers. And right here you see the sample of the 100 unit syringe. So this one, each line, it's equal to 2 units. But this is the 100 unit. Okay. I wish I could have, normally in class, I pass them out for students to see them and at least, you know, have that visual. Then we have some other syringes that have a dual scale, so that shows you, it shows you, you know, exactly like how many units, so you can have a better view for the even and the odd numbers. We don't see this very much. Okay, so how do you know which syringe to choose? Well, you're gonna go based on the amount that you have to withdraw. If it's 10 units, if it's only 10 units that, I know this is 5 units that you have to withdraw, well, you want to get the one that's 50 units, right? As long as it says U100, you want to get that one instead of the 100. And I'll tell you, at the hospital, we have, I think mostly 100s, 100 units, but it depends. Sometimes we have the 50, but you want to get that one that's, you know, less. And then, so this is another example, then Novoline and the MPH. So this is an intermediate acting insulin, 26 units, sub-Q, 30 minutes. So 26 units, and you can see if you have either way, the 50 unit syringe or the 100 unit syringe, it's gonna tell you, you know, like it gives you here an example of how far would you go. So remember that the 50 unit syringe, each line means a unit, and the 100, each line means 2 units. So, you know, it just gives you a visual there, an example. Right, so let's see this problem. Determine the appropriate insulin syringe to administer the amount of insulin order. This is 27 units sub-Q before breakfast. So 27 units, which one would you use first of all?
50 units.
Yeah, right, you would use this, right? This one, and you will go down to the 27, since each one is 1. So there's the visual right there. All right, let's see that one. Determine the appropriate insulin syringe to administer the amount of insulin order. This is Lantus. Lantus, it's a long acting. This is the one that lasts 24 hours, 23 units sub-Q every evening. So we normally have patients take it in the evening, and we always tell them to get up in the morning and take a little snack, because you know, their blood sugar can get pretty low. So this is 23 units. which syringe would, or which syringes would you actually use for this order?
The 30 units.
You could
Or
use 30. And you could also use the 50, right? You could use either or. The 30 and the 50. Very good. This one says determine the appropriate insulin to administer the amount of insulin order. This is Humulin 7030, insulin 33 units, sub-Q 30 minutes before breakfast. So 33 units.
you could use the 50 units
Or the
or
100.
100.
You could use the 50 units. You could use the 50, and if you use the 100, you would have to get it right in between, because remember each line is 2. So this will be more accurate, the 50. And if you had the 100, then you would have to be right in between the second line and the third line, right? So it's 33, 32. No, right in between the first and the second line. No, the second and the third line. Sorry, guys. So, okay. Let's see. So a little bit more about combining units. When we get the orders sometimes from the doctors and they tell us they give, I don't know, I'm gonna use the way it says here, 17 units of Humulin R or regular insulin, and then give 5 units of MPH. So you guys have to mix them up and add them up. So then you have to okay, how many units are you going to give in total? If it's 17 and 5, then you have to add them up, so that you know how much is it going to be in the syringe. It's going to be 22 in the syringe, right? So it's going to be 22 in the syringe. So like I said, in the nursing program, we'll teach you guys, because normally this is one clear vial and this is one cloudy vial. So we normally draw out of the clear first and then out of the cloudy. If I draw the cloudy first and then I mix, and then for some reason gets mixed up with the first, I have to discard both vials. So we have to be really, really careful when we mix them up. And we always do, like I said, I always draw first out of the clear. And since it's clear, I can tell, okay, it's all clear. And then I'll go and get the remaining from the MPH. So it's a skill. It's a skill that we do in nursing, and that we actually have the students draw from the 2 vials, even from the glass. In the nursing program, we'll have you guys break a glass vial and then draw from there. Same thing with the insulins. We'll teach you how to do each one and how does it normally go. And right here, all you need to know is that if you get 2 insulins, you're gonna mix them up, and then you know how much will be your total. Let's see. Tell me which of the 2 syringes holds the amount of insulin that's ordered. What's the correct amount of insulin?
So 19, wait, even 6.
It would be the 50 unit.
So 25 units. So yeah, the first syringe, 50 units syringe.
The first one, right? Yeah, the first one. Yeah. So very good. So, híjole, I think the hardest thing on this chapter is memorizing the insulins, the onset, the peak, and all the duration on your insulins and the types of insulins. But I think, yeah, that's quite a bit. Do you guys have any questions?
No.
Nope. Very good. Let me stop the recording. Let's see. I had a question. Stop recording.